Hi friends, so this is a bit of a different video, and this video is actually for my friends who have been asking me questions about practicing medicine in Canada, coming from the UK. So this video is very casual and it's for you guys basically. So I've been working in Canada now for about, say, 14, 15 months now. And I actually moved to Canada in 2023, late 2023, from the UK, where I had lived for quite a few years. And that's where I did my GP training, right? So this video is basically to talk about the differences between practicing in the UK and practicing here in Canada that I have noticed. And this is going to be based on both the medical aspect of things and the social life as well. So like the lifestyle in Canada as a whole. Okay. So overall, I would say that my experience has been greatly and largely positive here in Canada. So I am actually in Alberta. So I am in Calgary, Alberta, and this may be province specific. So this may not be helpful to you if you're looking at moving to another province. But I would say generally, things are pretty similar everywhere. Okay, so I actually wrote a few points down on my laptop to help me. So I will be referring to my laptop a few times. I actually just got back from work, which is why I'm still dressed in my scrubs. But so the first point I wrote here is that they are different countries. Obviously, the UK and Canada could not be more different. They are literally like night and day. Okay, the UK is small, Canada is large. The UK is very nationalistic, Canada is more provincial. So like different provinces will have different rules for how they do things, and Alberta is gonna do things differently than BC, for example. And I know lots of us are moving to BC, which is great as well. But I would say pay is pretty comparable everywhere else, and you get paid more if you live rurally, which I don't ever want to do again. Okay, so I would say pay is better overall. So obviously in UK you do niche things like locum GP work, which I heard isn't that lucrative anymore. But in Canada, for doing like normal 8 to 4 or 9 to 5 versus the UK, you definitely get paid more in Canada than the UK if you were to compare apples for apples. Obviously, if you wanted to get paid more in the UK, you would just work more on favorable hours, be more open to moving around the country. But if it was just like you're in this city, you want to work 8 to 4, which again, not possible in the UK. You're usually working like 8 to 7, if I'm being honest. But if you wanted to compare apples to apples, oranges to oranges, the pay is definitely better here than in the UK, which is not surprising because pay is kind of a taboo in the UK. You're seen as greedy if you want to be adequately compensated for your services. I'm not going to go into all of that, but basically the pay is better here if you were doing the same thing. So for you to make what we make here, you would have to work a bit more in the UK for sure. Like you would have to be more open to moving and all those things. All right. Okay, so for the third difference that I've noticed personally is you have more, how did I put it here? Chance to grow with limited bottlenecks. So in the UK, I find it so, I think this goes hand in hand with my fourth point, which is autonomy. In the UK, I find it so restricting in the sense that you are treated like a baby when you want to do things that you already know how to do. So for example, to do like an injection, for example, you've learned this thing in medical school. It's basically being a doctor, but you have to go through this module. You have to do this this written module. You have to be observed doing this thing. I just find it very unnecessary. Whereas in Canada, if you are competent enough to do it, then you should do it. So for example, I'm going to use one big example here is IUDs and Nexplanon insertions, for example. To do this in the UK, you would need to go through modules, and then you'll need to, these modules are like 26 modules. Then you need to go get somebody to sign off your competency. Oh my God. Anyway, here in Canada, it's different. There are training options for things like IUDs and Nexplanons. I did get like national, that I don't know if it's national, but Bayer, who is the owner of Marina, and I don't know who owns Nexplanon, but they do these training things where you just do a training day, and you are, and if you feel competent enough, then you do it. So it's like see one, do one, teach one. And actually, before I actually started insertion, I just watched a few of my colleagues. I had them supervise me when I was doing it, and I've been doing it since then. I've put in at least 200 IUDs in the last year, I would say. Yeah, because it's not that, it literally is not that hard. It's just be a doctor. Basically, be a doctor. It's, you have more, you have, I don't know how to put it. You're not everyone is looking over your shoulder to see if you're making a mistake. Like, you're actually in charge here, which I find less stressful. So if you know what you're doing, then you'll have no issues. If you don't know what you're doing, then just don't do things that you're not competent doing. Okay, I don't need you breathing down my neck saying I can't do an IUD because I didn't do 26 modules of learning the anatomy of the uterus, which we already learned in medical school. We already did rotations in obstetrics and gynecology. So I just don't see the point in doing all those things. And I think those things just limit things that we can do as physicians in the UK, and just creates unnecessary bottleneck. See, so if I had a patient now who was requesting an IUD, and they have no contraindications, I could literally get it in tomorrow. Whereas to get an IUD in the UK is like, you have to go and see somebody who is competent enough to do it and then get booked in. I just find those things so, I don't know. Another difference is in the UK, many people have lots of support with nursing staff, with things like asthma nurse, and we have diabetes nurse and things like that. Here you're kind of in charge of all those things. You of course you can always refer if you get stuck, but you are responsible for titrating your patients' COPD medications, their asthma medications, their diabetic medications. Ozempic is a big thing that's quite popular here now, and I just think it's better overall for the patient. Like, when you just do your job as a doctor, it's better it's better for the patient. It's better for you. You're not waiting 25 years, so to speak. Anyway, I'll not get into that. Okay, so one thing that is better in the UK is the referral system. So referring in the UK is so straightforward. If you have a patient with a rash that you're not too sure of, and you want dermatology to take a look, you just refer to the dermatology department in where you are. So like if you're in, say, Preston, for example, you refer to the local tertiary center, and the patient gets in. Whereas here in Canada, you need to know who you're referring to or what service that you're referring to. So there's like 500 dermatologists in Canada, in Calgary rather, and they all have different systems, so to speak. I need to know somebody's business, right? So like if I'm referring to, say, rejuvenation dermatology, for example, if I didn't know rejuvenation, I wouldn't be able to refer to them. See? And another thing that I really think that UK has over Canada is the 2-week wait. So 2-week wait for my Canadian watchers is when you suspect that this person might have cancer based on some rules or the guidelines or whatever, you can refer and they should be seen, examined, and a diagnosis reached within a couple of weeks. Whereas in Calgary, it's different. Okay, so luckily I've only had to do this twice or 3 times because my patient panel is actually quite young and we haven't really had any of these things. But it's very hard to even if you have a diagnosis of cancer, it's very hard to know exactly where to refer them, and it's very hard to get them to be seen quickly because, I don't know, it's just hard, and I don't like that. I do not like that. Another difference is doctors are very, very well respected here, at least in Calgary. So businesses will loan you money just by virtue of you being a doctor. Like you get preferential treatment So, like for example, my family and I were able to get a mortgage before we even landed here in Canada, which is pretty much unheard of in the UK. So they used our credit history from the UK, and because Canada is short staffed, I already had a job before I came in, so we just used that. We used those two things, and the bank said yes. Of course, we jumped through a few hoops, but the hoops were very jumpable through. And we did all this while in the UK, and then when we came in, we signed the thing and we moved in a couple of days. So we just did Airbnb for 2 days, and yeah, in the UK that would never ever happen. If you wanted to start a business, like you wanted to start your own clinic or whatever, they would support you the money. Of course they would. It's like interest, it's a loan, of course, but just the mere fact that they'll support you 100% of your costs. At least here in Calgary they will. If you wanted to, they would give you like different discounts on like bank cards and stuff. And not to say, I'm not naive, it's good business for them as well. But even if it's good business for them in the UK, they're not going to do that for you. So that's one big difference. And you're just well respected there. And even with patients, sorry to say, but I found it easier to really. I found patients nicer here overall. They're not so angry at us, and that is really refreshing. You get your patients bringing you like thoughtful gifts. So this is not like, if my patients never ever brought me a gift, I would be okay with it. But it's just sometimes they put effort into this gift. So it's like a 5-year-old making me, a card, writing my name for Santa to bring me a present. It's just thoughtful things like that, even from like young patients. And I just find that really encouraging as well. So one thing that I was also asked to talk about was the PA and nurse practitioner situation here in Canada. So I'm going to be very honest, I don't know much about that. I know it's really, really bad in the UK at the moment, and there's like title encroaching and things like that, and GPs can't find jobs anymore, or it's difficult to find a job, or like rates have really reduced. I know that the place where I was working right before I came here, that everything has really, really changed. I can't really speak on that here. I know that we have physician assistants, but they are doing physician assistant jobs. Like they are not responsible for a practice yet. I know that nursing practitioners can have practices. They can have their own practices here. Like you can have an NP-led practice. So far, yet it hasn't been a big issue in the sense that family doctors are still preferred, and there are still like lots of job opportunities. Like guys, there are no, like it's hard to find a doctor here in Calgary. Like to see my own doctor, I have to drive 30 minutes to see my doctor. If I was driving 30 minutes within London, I would. Anyway, yeah, it's hard to find a doctor, so I can't really speak much on that. But what I know is right now it's not a big problem yet. Now to talk about lifestyle difference. So food is definitely more expensive here. That's all I'm gonna say. Like food is, it's ridiculous how expensive food is here in Calgary at least. And my I've got friends and siblings who live in other parts of Canada here, and they do say the same thing. Food is quite expensive. I'm gonna say as a doctor, you're not gonna have an issue with affording food, but it's definitely like jarring. Like for example, if you go to Costco and get a pack of chicken drumsticks, so like maybe like 20-30 drumsticks, yeah, like 20 drumsticks would be like $35 or something, whereas in the UK, if I were to walk into Tesco or something, it would be like maybe £6 or something. I think it was £6 for the thighs. Anyway, food is expensive. But you get, I don't know, I find it, as a Nigerian, I find it easier to adapt to food here for sure, because you have lots of options. They may be expensive, but they're there. And I love Costco so much. Costco is game changer. It's also harder to find butchers. So like when I lived in the UK, for example, if we wanted like a whole goat or something, we could go to the market in Manchester, or when I lived in London, we could go to the market in London and just go to the shop and get a whole goat and they'll chop it for you. Here you have to find somebody to share it with you. So you have to find someone who also wants a goat at the same time as you want a goat, so that you can have half and they can have half, and it's quite expensive. So right now we really focus on chicken and fish because they're easier to source. But yeah, food is expensive. So schooling, another thing is schooling. So schooling for kids is different. So for example, in Calgary at least, your child starts kindergarten at 5, and it has to be the year that they turn 5. So for example, in the UK, you start reception at 4. As long as you're 4 before September, you get into reception. Here, you have to be 5 that year. So like the year is January to December. So if you are born January 1, then you have to wait until the year where you turn 5. So say you were born in 2020, January 1, 2020. So you would go to school 2025 September is when you would get into school. But also, I'm not sure, like if you have a child with special needs, it takes a lot of getting used to, for sure. Like I think in the UK you would be put in some specific schools. Again, I don't know much about that side of things, but here special needs schools are mostly private after the age of 5, because the government funding isn't perfect. You can ask me more questions about this if you want. I don't know how helpful that bit is. So bigger houses and cheaper depending on where you live. So most houses are bigger. This is definitely the biggest house I've ever lived in, and I've lived in 1, 2, 3, 4. 1, 2, 3, 4. I've lived in 5 houses in the UK. This is definitely the biggest house I've ever lived in, but also the cheapest. If you were to convert it to pounds, maybe not so true. When we lived up north in Preston, of course the house was tiny. This house is like almost 3 times that house, but definitely not in price. So it's cheaper. You get more bang for your buck, for sure. This is Calgary. Of course, how places like Vancouver and Ontario are super, super expensive. I don't know how expensive because I don't live there and I don't care enough to check, but I've heard they're pretty expensive. Okay, oh my god, clothes. Clothes are so ugly here in Canada. You don't have a lot of, oh my god, if you can get, every time I'm looking for, because my kids are growing so quickly, I'm always looking for somebody coming from the UK, because if I buy from the UK, then I have to pay customs, which is insanely expensive, but the clothes are just so much better. I buy all my kids' clothes from Next. They last long. I have 2 boys, and then when my older one, he's a boy, he will use the clothes the way boys use clothes, and will be able to keep it, and his younger brother would be able to use it when he gets to that age. But in Canada, oh my god, I bought a pair of pajamas for my son from the store, and he wore it once and it tore, and it's ridiculously expensive, and they just don't have a lot of options. I just find their clothes really ugly here. You definitely don't have a lot of options, and when you do get the options, they are really, really expensive. But no one is touching the UK or Europe generally in terms of clothing. No one, not even America. So yeah, that's a big difference that's going to take a lot of getting used to. Yeah, the clothes are, oh my god, the clothes are, yeah. And the final thing I'm going to talk about today is the weather. So the weather, while it's more harsh here in Calgary, I still prefer it in the sense that it's definitive. So the summer is summer, the fall is fall, the winter is winter, and what's the other one? The spring is spring. So when we lived in the UK, it was like mostly gloomy, like all the time. It's just gloomy and rainy, and you get like 4 weeks. For context, my younger son was born in the middle of summer. It rained on the day he was born. It rained on the day of his naming ceremony, which was again middle of summer. So, but here it's very like, I don't have to go out in 25-degree weather with a backup jacket, because I know that the weather is not going to change that quickly, and if it does, it will change back just as quickly. I don't know, it's more definitive. So, but it can, oh my god, it can get so cold. This year we've been really, really, really lucky in Calgary. It's only snowed like 3 times. We had one super snowstorm in like October or so, but now the weather is better. It's going to be colder next week. So by colder, I'm talking minus 28 freaking degrees. But your house inside it. Look at me, I'm wearing short sleeves. It's like minus 15 out there. In the UK, inside my house, I would be wearing a sweater. So they have had the indoor heating, so you're not going to be cold, and you're not going to pay through your nose for your bills, for example. Like, I've never, like, even if I leave all my lights on and my water, like, my bill is never more than a certain amount of money for the amount of people, the number of people living in this house and how big the house is. Whereas in UK, your electricity bill alone, whew, you know what I'm talking about. Your electricity bill alone, bro. Anyway, yeah, so I would say the weather is vastly different. It's very sunny here, which I find really, really great for your mood. It's sunny like 300 days out of the year, so it might be minus 26 degrees, but you're gonna see the sun, and I find that really encouraging. So I would say, all in all, I prefer the weather here, even though it can get really, really cold, because you can kind of predict it. So those are my differences that I can think about now. If you have any questions, or you want me to talk about something a bit longer or anything else, please leave a comment down in the comment section below. Please like and subscribe. Bye.